Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. President Muhammadu Buhari receives his COVID-19 booster shot. Ebonyi government ramps up efforts to ensure that the state reaches its vaccine administration targets. And the World Health Organization urges people to cancel some of their holiday events as the Omicron variant spreads globally. Thank you for joining us. According to the Nigeria Center for Disease Control (NCDC), the Delta and Omicron variants are responsible for 500% increase in the number of confirmed COVID-19 cases over the past 2 weeks across the country. Now, the agency, which now confirms countries seeing its fourth COVID-19 wave, is asking Nigerians not to mingle this holiday. And if one suspects symptoms suggestive of COVID-19, like a sudden loss of taste or smell, with fever, headache or runny nose, it may be COVID-19. Well, here's a look at the pandemic update from last night.
1,368 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 19 states and the FCT, indicating an increase from the figures reported earlier. Lagos led the chart with 844 cases, FCT logged 209 cases, Oyo had 58 cases, Abia 51, Ondo 39, while Ogun registered 30 cases. Kaduna logged 26 cases, Delta 20, Akwa Ibom 17, Osun had 15, Ekiti registered 12 cases. Other states including Anambra, Zamfara, Cross River, Kano, Kwara, Rivers, Bauchi, Gombe, and Plateau registered a single-digit infection. The new tally has increased the total confirmed cases in Nigeria to 225,255. The report also includes a backlog of confirmed cases, discharges, and 0 case from Sokoto State. 123 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 211,660. There was no additional death resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,985. Currently, there are over 10,000 active cases in Nigeria, while over 3.7 million samples have been tested so far. More than 8.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4 million persons have been fully vaccinated. The total global confirmed cases have surpassed 275 million, while deaths are beyond 5.3 million.
In line with the recommendations as a result of the dangers of the latest variant Omicron, President Muhammadu Buhari has received the COVID-19 booster jab at the State House. The booster shot was administered to the president by his chief personal physician. According to the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shoaib, who was present, it is an indication that the federal government is playing an exemplary role while doing everything to deliver safe vaccines that would protect against severe forms of COVID-19, including the Omicron variant.
What Mr. President has done today is again to indicate to all Nigerians that the federal government does everything to make sure that only safe and efficacious vaccines are brought into Nigeria, and that when they are brought into Nigeria, we'll double check to make sure that it fits the very high standards that have been set by NAFDAC. So when you go to any health facility, when you go to any mass vaccination site, one thing that should be clear in your mind is that this vaccine that is going into your body is safe and is going to protect you against severe forms of COVID-19. It will also protect you from dying from COVID-19. So for example, if you've gotten the AstraZeneca vaccine, first and second doses, you have to wait 6 months after the second dose to get your Pfizer-BioNTech. If you actually got the Moderna vaccine, you also have to wait for 6 months before you get the second dose, or you get the booster dose, right? So after the first dose of the Moderna, you get the second dose after 4 weeks. Then after 6 months, you are now eligible to get the booster. If you got the Johnson & Johnson vaccine as a single shot vaccine, then you are eligible for a booster after 2 months. Just like Mr. President has shown leadership, the chairman of the Presidential Steering Committee on COVID-19 has also taken his booster dose. I am aware that Mr. Vice President has also taken the booster dose. The ministers of health, everybody has shown leadership.
Meanwhile, the House of Representatives has passed the controversial Infectious Diseases Bill. The bill is thought to have been thrown out by the lower chamber following the negative reaction from Nigerians, including the former Director General of the NCDC, Dr. Chikwe Ikwazu, and the Minister of Health, Osage Ehanire. No word on the bill had been heard until now, since the public hearing on the 11th of June 2020. The details of the legislation are unclear as at this moment. Well, this week, the Nigeria Center for Disease Control, NCDC, is launching its Yuletide season campaign themed Celebrate Responsibly as part of the Take Responsibility campaign, which began February 2020. Now, Celebrate Responsibly focuses specifically on measures Nigerians need to take to protect themselves and their loved ones from COVID-19 during the period. The campaign targets the entertainment industry, transport, religious settings, media, security personnel, young people, and the general public to promote adherence to the COVID-19 preventive measures during this festive period. Well, joining us to talk some more about this, Professor Titus Ibekwe, a public health physician and ENT surgeon. Thank you for joining us on the program.
Thank you, Millicent, for having me again.
All right, Prof. I mean, are people really listening to the NCDC, the steering committee of the presidency, the Ministry of Health, the Primary Healthcare Development Agency, when they put out messages like this, Celebrate Responsibly?
Yeah, this is a wake-up call for each and every one of us. And these messages are coming through the heels of some scientific findings, evidence-based information on ground. It is presumed that people should be listening. But beyond just putting this out in the radio and television and the print media, there should be able to be a follow-up to ensure that the Enlightenment campaign is taken down to even our hinterlands, so that it will get to the extent of reaching those that are in the hard-to-reach areas, in different languages, in different forms of communications, and through people that they really trust and people they have hold at very high esteem. You recall that when we talk of non-pharmaceutical measures of protecting, you will see this mainly in our cities. But as
Apologies for that audio. We'll try to get in touch with Professor Ibekwe very shortly on, indeed, this new campaign by the Nigeria Center for Disease Control. But next is a story from Ebonyi State, where the governor, Dave Umahi, has flagged off the statewide COVID-19 vaccination for the people there. The governor at the Christian Ecumenical Center, Abakaliki, urged the people to freely take the vaccines, assuring of its efficacy. He also calls on staff of the state's Ministry of Health and local government chairmen to step up efforts in ensuring that the state achieves its target in vaccine administration.
So that if possible to go from house to house to do the vaccination. So the Ministry of Health has no holidays. They must go from house to house vaccinate our people. May I, with total gratitude to God, out of mercy, committed, dedicated, and consistent vaccination of every man and woman in Ebonyi State that is above 18 years.
And this is hoping that we have our guest, Professor Titus Ibekwe, on the Celebrate Responsibly campaign by the NCDC. Professor?
Yeah, Millicent, thank you. I was actually explaining that there's need to also do more towards intensifying this campaign, that it is really apt to have such a campaign at this point in time, given the reality on ground that we have five-fold rise in infection of COVID-19 just within this very brief period. And we're still counting because Omicron is known to be very infective. The rate of transmissibility is very high. That is one characteristic of this variant. Although the disease may not be as severe as the Delta variant, but it's transmitted very fast. It spreads very fast.
Let me ask this, and this is, Prof, if I may butt in, would you liken what we're seeing, largely this virus? Do you think that it's persisting, and this is with Omicron coming in, because of the inequality in vaccination?
I would say, is a conglomeration of factors. Well, across the globe, you can mention inequality. But let's bring Nigeria into perspective. We have not consumed all the vaccines that were even donated to us. And the information out there is showing that some are very close to their expiration dates. Not up to 10% of Nigerians have been vaccinated. Yet the vaccines are there in the shelf, waiting for those that will consume them. So that's why we have to go beyond just this and look at the factors that will help us to increase the intake of this vaccine. One is availability, which I don't think is the problem right now. The second issue is the issue of good enlightenment program, to be able to convince people so that they really understand and embrace this culture of coming to get vaccinated, coming voluntarily, not being coerced in the process, because it's what you believe in that you can internalize. And the third factor here is debunking a lot of fake news and rumors that are making the rounds, especially within the social media, getting people confused, to debunk all this news and make sure that the correct information is put out there in the public space. So vaccine is one thing at the other hand, but very importantly is the non-pharmaceutical measures, which cost little or nothing. It's just being faithful and applying some level of due diligence on our own part as citizens, to use our mask, physical distancing, and also to cleanse regularly our hands and good respiratory hygiene. That's why this Celebrate Responsibly is okay, but we should also expatiate on this and keep on emphasizing that if you mustn't travel, please stay where you are. Because sometimes you may take precautionary measures on your own part, but some extraneous factors will not allow you to apply this to the end. Number one, let's not forget that this period is the period of what? Of Harmattan. And during Harmattan, the wild wind is so fast and is so dry, it's moving very fast. And these are droplets, the mode of transmission of COVID-19. So you can see that the weather, as it is right now, will be a vehicle that will also help in propagating this the more. So, and when people are traveling with the massive traveling and also, you may not be able to avoid clustering and crowding. The public transportation system, it is difficult to maintain physical distancing. But applying a lot of caution is what is needed. Those who are moving in groups, to make sure that they wind down their glasses. This is not the time to consume air conditioner and keep on recycling the same air within.
Prof, I must quickly get this question in as we head to break in just a few seconds. And this is, should people take advantage of, this Yuletide, the festivities to, rather than celebrate, go and get their vaccines?
Oh, yes, this is an ample opportunity to do this. But as I said, we need to do more individually and collectively, especially those who have been entrenched with this responsibility, NCDC, Primary Healthcare Development, Ministry of Health, and indeed all of us health workers, media people, to carry these messages down to the grassroots in languages that they understand. We should see ourselves as stakeholders. Once we do this and carry out good campaigns, so a combination of both non-pharmaceutical measures and the vaccine will give an additive, towards a good safety measure that will help the country at large.
Thank you so much.
So that the two will be synergistic in action. Thank
we
you.
always appreciate your time. Happy holidays. Thank you so much. Professor Titus Ibekwe is a public health physician, ENT surgeon. Thanks for joining us.
Thank you for having me.
Still ahead, Zamfara takes vaccination campaigns to communities in Gusau metropolis. Please stay with us. Welcome back. Zamfara state government, in its effort to curb the spread of COVID-19 in the state and prevent the Omicron variant, has taken its vaccination campaign to one of the most populated communities in the state capital. The State Primary Healthcare Board, in collaboration with the Association of Resident Doctors, FMC Gusau branch, picked Zawiya community apart from its population, but also due to other healthcare challenges, which they believe a broad base of vaccination exercise can tackle.
Like you can see, it's a collaboration between the State Primary Healthcare Board and the Association of Resident Doctors of the Federal Medical Center, Gusau. It's a sort of integration that we are trying to do to ensure that we expand the broad base of our vaccination exercise in the states. That's the COVID-19 vaccination. So the association is marking it's an annual event that they are on to, and it's a week-long activity where there are a series of activities. So one of the activities there is the outreach program. So we now integrated other services in the outreach program to ensure that we leverage on its existence to increase the vaccination coverage across the states.
Away from Nigeria, South African scientists are investigating the highly plausible hypothesis that the emergence of the new COVID-19 variants could be linked, in some cases, to mutations taking place inside infected people whose immune systems have already been weakened by other factors, including, though not limited to, untreated HIV. Researchers have already observed that COVID-19 can linger for many months in patients who are HIV positive, but who have, for varying reasons, not been taking the medicines that would enable them to lead healthy lives. As they push ahead with their research, the scientists say they are anxious to avoid further stigmatization of people living with HIV in South Africa, which is home to the world's largest HIV epidemic and globally. Now, South African scientists have faced criticism after their recent discovery of the Omicron variant and are keen to preempt any suggestion that their country or the continent should be singled out for producing new variants. Meanwhile, a civil society group in Ghana is urging the government not to make vaccination of the coronavirus disease compulsory. The group is of the view that any attempt to force vaccines down the throat of the citizenry would be an abuse of their fundamental human rights. This comes as the government in recent weeks indicated that vaccination would be mandatory in order to access public services. Well, joining us to talk some more about this is Dr. Samuel Ofori Agekum. He's a medical practitioner. He joins us. Thank you for joining us on the program.
Thanks for having me.
Now, Ghana appears to have taken a firm stand about mandatory vaccinations, barring unvaccinated persons who will arrive the country effective 29th of December, I believe. How are people reacting to this?
Well, the reaction has been quite mixed, I must say. For those who are fundamentally in favor of vaccination, most of them do not have any problem at all with such an arrangement. But, as you noted quite a while ago, there are some people who believe that public health safety should not trump issues of personal liberty. So for those who feel they have the right not to be vaccinated, they have some reservations. But sometimes in case of such a pandemic, I guess the government has to take stringent measures to protect us all.
Give us an idea of how fast the Omicron variant is spreading in Ghana and, what government has been up to try to stem that spread.
To be sincere, not as fast, simply because the government was quite proactive in its containment measures. So initially, there were about 2 cases that were reported. It shot to about 32, but almost all these cases were imported cases. So when the government noticed, they started contact tracing immediately, putting people in isolation to make sure that there isn't much community spread of the Omicron variant. So as we speak, there haven't been so much of the Omicron variant cases reported yet, but the jury is still out. Maybe there's time. Over the course of time, we will see more of such cases being reported, hopefully.
So let's look at the mandatory vaccines which the government has imposed. Are people now racing to get vaccinated? Also, the Ghana service, I believe, said that it wants to also vaccinate children 15 years and above, and also all workers in schools, before the next academic year. Are there enough vaccines in the country to achieve the same?
Well, there aren't. We don't have enough at the moment, but I believe there are measures in place to bring in new vaccines. Because as of last week, there were new vaccines that came in, about 3 million doses or so. The government's plan is to be able to vaccinate about 20 million people. That brings us to roughly around 40 million doses of vaccines. Currently, we do not have that much, but I believe for the government to come out with such a program, they already have plans in place to procure much more vaccines to cover the population targets they are looking at.
What's your take on booster shots? Seeing as Africa, we don't even have enough vaccines available to the relevant population to achieve herd immunity.
Well, you see, the virus has been, behaving quite differently in Africa as compared to the other countries. But that still doesn't mean we should relax. So the vaccination is quite necessary. And even though, as you are saying, we do not have enough to reach herd immunity, we still must go ahead to reach the population size, the sizable amount of people that we can be able to reach, which I believe will help us in containing the disease, preventing much more deaths, and also preventing severity. Because as you see, people can even be infected after vaccination, but then at least if they have been vaccinated, the severity and hospitalization significantly reduced.
So are you in favor of the booster shots, which some are defining as a 3rd dose?
Yes, I am in favor, but unfortunately, the Ghanaian government's policy as at the moment is not focused on booster doses, because the first target of the 20 million people being targeted for vaccination has not been achieved yet. But if we have enough doses, then obviously I am for booster doses being given.
All right, we'd like to appreciate your time. Thank you so much. Dr. Samuel Ofori-Agekum is a medical doctor in Ghana. Thanks for joining us.
Thanks for having me again.
And the WHO has said the Omicron variant of the coronavirus is spreading faster than the Delta strain and is causing infections in those already vaccinated. In the US, Omicron has raced ahead of other variants and is now the dominant version of the coronavirus there, accounting for 73% of new infections last week. The Centers for Disease Control and Prevention numbers showed nearly a 6-fold increase in Omicron's share of infections in only 1 week. Well, here's more on the global update.
The United States is providing the World Health Organization, the United Nations Children's Fund, and 5 other global aid groups an additional $580 million to fight COVID-19. The pledge comes as health officials in the US say the new Omicron variant of the coronavirus now accounts for 73.2% of new cases over the past week, and as the country's first known death linked to the variant is reported in the state of Texas.
Welcome,
Meanwhile, the WHO has said the Omicron variant of the coronavirus is spreading faster than the Delta strain and is causing infections in people already vaccinated or who have recovered from COVID-19.
There is now consistent evidence that Omicron is spreading significantly faster than the Delta variant. And it's more likely that people who have been vaccinated or have recovered from COVID-19 could be infected or reinfected.
The health body urges people to cancel some holiday plans as the variant spreads globally. In other developments, Thailand has reinstated its compulsory COVID-19 isolation for foreign visitors. The decision means visitors will have to undergo hotel quarantine, which ranges between 7 to 10 days. A cluster of coronavirus infections linked to a U.S. military base in Japan has grown to about 200, raising fears over the spread of the virus in the community. However, it's not clear how many cases in the growing cluster at the military base were also of the Omicron variant. Officials in New Zealand have pushed back plans to allow quarantine-free travel for residents returning from Australia.
Cabinet has decided to push back the date for self-isolation for those travelling from Australia from the 17th of January to the end of February so that we can accelerate the rollout of that booster program and have as many people boosted with their vaccination before we have people isolating at home across the international border.
The country, which responded to the pandemic with strict border rules, blames caution about the spread of Omicron for the delay.
You can visit our websites for more updates and also a better understanding of the pandemic. It's channelstv.com, news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.